Hey.
Hi Brett, how
Hey
you
there.
doing?
Good, Austin. How are
Great
you?
to see you today.
Good to see you too, buddy.
This would be what, your third session?
Right before my third.
Feeling good?
Yeah, we're very excited.
Awesome. It's been a pleasure working with you. We've been through a lot together just in a couple of sessions.
Absolutely.
It's been really a pleasure. I'm hoping that by allowing you to speak about your experience, it allows other people to get some insight into sort of what we do here, why we do it. And I don't think there's any more important perspective than from the perspective of our clients.
Absolutely.
So if you wouldn't mind introducing yourself and just what brought you to NeuroRelief.
Okay, my name is Brett Bundy. I live here in Hollywood. Been here for about 15 years. Started seeing my psychiatrist about 2.5 years ago, Dr. Perry Johnson, which you're very familiar with, and he's a great guy. Thought that since I suffer from not only depression, I suffer from pain, that this might be a nice alternative, or in conjunction with his work, to come see you.
Absolutely. How is he doing?
He's doing great.
Awesome.
I just saw him this morning. He says hello, of course. And
Yeah, he's great.
he's a great guy.
So how long have you been dealing with your personal struggles? If you wouldn't mind sort of describing how that all started.
Pain started in 2000. That's when I ruptured 3 of my discs in my back.
How did that happen?
Oh, it's just a silly accident. I was the director for Nissan Corporation's corporate fitness wellness facility, and we had a helium tank that was for people to blow up balloons, and I decided that I would lift it into the back of a truck, and I was much heavier than I thought.
Gotcha.
So I ruptured the 3 discs, and I never worked again.
And then what went along with those injuries, and sort of what occurred then with you personally?
Within 6 months, the depression kicked in, and that was in 2000. So within 6 months, I felt like my life was over. This injury, they didn't know how to fix it at the time, and I truly started the depression route, and it kicked in along with all the pain medicines. I think they supported the depression to a great deal.
Mm-hmm.
And with the combination of depression and pain, just life isn't worth living. It truly isn't. But the best thing you can do is change your perspective, and I think that's what ketamine's brought me.
And so the depression is different for different people.
Mm.
What did your depression feel like to you? If you could describe it.
As soon as I couldn't do any of the things that I really enjoyed in life, definitely the depression set in, and then it really turned my head towards the things that I did like, that I just wouldn't do anymore. And then I found myself really doing nothing.
How did individually the chronic pain and then the depression, how did that impact you in terms of your daily enjoyment? What struggles transpired as a result of that?
Incredibly. I mean, the pain is my #1 limiter. There's days where I can't get out of bed. There's days where I feel pretty good and I go pick up a sock off the ground and I end up in bed for a couple more weeks. It's one of those things that if my lower back with those prosthetic discs goes into spasm, I'm a goner. I mean,
Understood.
yeah, I've had
What
broken.
does the pain feel like?
It's a sharp pain. When I actually get the spasm, it's like my whole back locks up like a fist, and I drop to the ground. I've broken 11 bones because of my back.
Wow.
I've fallen down some hills and stairs because of.
So a lot of compensatory injuries that
Yeah.
went along with that.
Absolutely.
What
absolutely.
what else have you broken besides your back?
Just in August, I broke my wrist in 5 places. I broke my arm and my ankle. Before that, I fell down the stairs and I broke my ankle doing that. I had an issue where I was picking up a sock and broke my left ankle and my right arm. So it plagues me, and I don't know when it's going to happen. So it limits me in so many different ways. I mean, the pain does, because
For sure.
Because now you can't do anything you want to do. You're kind of trapped in your apartment, in your house. I'm lucky to have a house, but weeks at a time I don't go out or do anything with my life because it doesn't feel like mine anymore. It just feels like the depression and the pain have overcome my life.
Understood. Did you try any other forms of therapy besides the surgery and the pain medicine?
Chronic pain, there wasn't anything they could do about my actual chronic pain except for give me every drug under the book. So I was on fentanyl for 11 years, OxyContins for 7 of those 11 years, also along with fentanyl. And then it wasn't until 5 years ago that I got off all the prescription medications.
Good for you.
And that was no easy task, especially
sure
after
not.
being on for almost 15 years. So I did that by myself without going to rehab and just locked myself myself in. And
it's got to be one of the toughest things a human being can go through.
it makes you want to jump out of your skin every moment. There's no
Yes.
sleep, can't eat, and nothing stays down. So
When you first started, I would assume they probably did put you on some medications.
first thing was obviously medications.
Mhm.
Done them, all the SSRIs. They never really worked for me, or if they did work, they made me feel right in the middle. I couldn't get happy about anything, but I couldn't get sad about anything.
Neutral.
Just neutral life is just terrible.
Yeah.
It's not worth doing. So I decided to get off those, and that was about 6 months ago. I'm here.
Understandable.
And I also sought after psychologists and psychiatrists to help to work through some of my issues, which has been very beneficial.
How did you find out about ketamine infusion therapy in general?
I'm very much on YouTube about anything that can help my situation, and I definitely experienced some pretty incredible videos and some terrific responses from that. And then
Excellent.
it was just so happened that my psychologist, excuse me, was friends with you, and he's like, I think you might be a perfect candidate since you suffer from depression and pain.
Yeah,
You
it
might
really
be,
is. It
you
really
might
is
be the
both.
guy, yeah, to try this out. And he was very enthusiastic about it. I just saw him earlier today. He says hello.
Awesome. I'll give him a call.
He's a great guy.
Yeah, he is.
And you and I connected on the phone, and that was an instant connection. So I knew you were the right guy for the job. And
Besides Dr. Johnson's referral, was there anything else that helped you to actually make the decision to come seek us out here at NeuroRelief?
yeah, you, Austin, you're a great guy. I think we hit it off right off the bat,
Yeah, for sure.
and I trust you 100%. So
Thank you so much.
this
Means
is a
a lot.
pleasure coming here.
Thank you. Explain to someone what your personal experience is like with ketamine. And obviously that's a complicated question.
Sure.
There's many layers, many depths of it.
Absolutely.
But it is very personalized as well. So if you could try to be as detailed as possible just to explain to people what your journey was.
Enlightening, absolutely enlightening. I've never felt like that. I never felt like I've actually been somewhere else while sitting in a chair. It really takes you to, I don't want to say another dimension, but it takes you to a different place, but it puts you in your mind. And it's amazing the things that you suppress, that allows you to see them.
And so what else did you experience while you were in the middle of these treatments?
It was a very emotional experience for me. I cried through the majority of the first session, but I saw all my dead relatives and people that have passed that shouldn't have passed. And
That's a burden that you carry with you.
yeah, all the time. Since I'm the last family member of my family, I only have my mom, so
Understand.
it's tragic to lose those people. But I got to visit them, which was, I cried like a baby, but when I got home, I felt relief. I felt like just the weight off the shoulders kind of feeling, which
That's amazing.
it truly was amazing.
How would you feel that specifically the ketamine has helped to address the two major issues that you came with? First, the pain, and then the coinciding depression.
Well, it gives me a different perspective on things, that's for sure. I definitely notice when I leave here how busy the world is, and when you're under the influence of ketamine, it's almost like you're floating above yourself, and it's such a peaceful, quiet, serene feeling. And then it makes you look down upon yourself or society in general, and just like, why is it so crazy, And
Why does it need to be?
Why does it need to be like that when I'm up here experiencing exactly what it should be like? And then you come back down from it, and then you remember those experiences, and you're just like, wow, that's an incredible place to come from.
Does it help you stabilize to refer back to those insights as
Yes.
you're going through your day
Yeah,
out in the crazy world?
Almost every hour I'm thinking about it. It's one of those, it's transformational for me, and I imagine for everyone else that's tried it. It really gives you a perspective on your life that you just can't get living your life.
How do you think that it's working with regards to your depression?
It's helping.
What does that feel like?
It's helping me tremendously. I can honestly say that. It makes you realize that you're not the only person that's going through this, number one. Number two, it makes all the people of the world seem together, and you're just one little grain of sand of that. And it's like, if you're sitting out here and you can look down on yourself, you're like, why are you worrying about the things you worry about? Why do you do the things that you do that you know that it's not going to be beneficial for you? When you can, you're the creator of your destiny, and it really makes you feel like, I got this. I I can hold on to this for a little bit and make some positive changes.
And how does that carry over into your daily life and your way of looking at things?
Yeah, it carries over on a regular basis. If it's not every hour, do I refer back to it in my mind, but maybe even every 10 minutes. Just when I see things that I had a feeling about when I was doing the ketamine, it just affected my whole outlook on things. Slowly but surely, only 2 sessions, I definitely look at people differently. I'm much more involved with people when I go, if someone's talking
You feel
to me.
safe to engage.
Yeah, it's not like how do I get out of this? It's like, this is something that we all do, and it feels good to communicate.
It feels good to be connected.
Yeah, absolutely, and that's what I think that would be the one thing I could say that I took away from it, feeling connected.
What would you tell someone who may be presenting with a lot of the same struggles that you've been experiencing and is considering attempting ketamine infusion therapy for those concerns?
Absolutely. I honestly think every person in the world should try it once. It will change your perspective on life, and I think it's an amazing tool that there's no way in the world I'd be able to do that unless I have a setting like this. It really takes you to a different place and really gives you perspective that is needed in life, and not enough of us get it. Super
Excellent.
true. Yeah, it's like it's a mini vacation for your mind. That's what it is.
Thanks so much, Brett.
Oh, it's my pleasure.
Really awesome having to, be able to talk to you like this, and let's get started on your next session.
Can't wait.